Okay, good morning, everybody. Welcome to Health Day. I'm particularly excited about today's conversation. Hallie, I've been waiting a while to be able to do this and to reconnect with everybody. So, welcome. We have an author in our midst today. Halle Tecco has a new book coming out called Massively Better Healthcare: The Innovator's Guide to Tackling Healthcare's Biggest Challenges. Nothing like a tall order to try to solve the world's problems in healthcare. And you're just the person to do it. And we have a great team here to help us think through and talk about some of the issues. And for those of you who are interested, the book is available for pre-order on multiple sites: Amazon, Barnes & Noble. The book has its own website if you prefer to order it there. Hallie, you are an entrepreneur, an investor, a professor, but what's really exciting to me is you were one of my early disruptive women in healthcare along with Jane. So this is really very special for me when you founded Rock Health. And Kate, you are Maven's founder. You founded it in 2014. You're the founder and CEO, and Maven has won many awards, including one of the world's most innovative companies. Congratulations. That's a very big deal. Dr. Neel Shah, yeah, Jane's clapping. Dr. Neel Shah, obstetrician. Welcome. You are Maven's Chief Medical Officer, Assistant Professor at Harvard Medical School, and Founding Director of Delivery Decisions Initiative at Harvard's Ariadne Labs. And then we have Jane Sarasohn-Kahn, wonderful Jane, also a disruptive woman in healthcare and health economist extraordinaire, who founded Health Populi blog in 2007, which is a must read, and really fabulous at pulling big trends together. I love, you call yourself a trend weaver, and I think you're phenomenal at that. So it's really my pleasure to be able to talk through the book, Hallie. And I wanted to open with a quote from one of my favorite musicians, who's not only a music person, but really I think of her as the high priestess of poetry. And I'm speaking, of course, of Patti Smith. And she had this to say: no matter how we advance technologically, please don't abandon the book. There is nothing in our material world more beautiful than the book. And so I can think of no better quote for you guys with all your love and work in technology and innovation, and now, of course, the book. So, Hallie, tell us a little bit about the inspiration for your book and why this book and why now.
Yeah, well, and Robin, thank you for bringing us all together. I think we've been working together for 15 years now, and
Long
you've been
time.
so supportive of me personally when I was new in healthcare. And part of the reason I wrote this book was because when I was new to healthcare, most people were not very welcoming. You were
No.
an anomaly. And the people that were helpful and believed in my vision, I will always remember and hold a special place in my heart for them, because they gave me the hope that I could actually make a difference in healthcare. And I promised myself then that if I were to ever have the privilege of becoming the old guard, that I would do it differently and I would welcome folks into healthcare. So I wrote Massively Better Healthcare because I've spent the last 15 years of my career watching brilliant people try to fix a system that feels impossible to change. And I started seeing patterns between those who were successful, like Kate and Neil at Maven, and those who are not, and people who probably threw in the towel, not because they didn't have a great idea, but because they could not overcome the inevitable challenges. And I wanted to share these lessons with more people. And I wanted to give folks, especially those that are new to healthcare, the playbook that I wish I had had when I started,
Oh,
and
great.
really a guide to building something that actually works in healthcare.
Was there something that surprised you when you were going through and writing the book? Usually, when I speak with authors,
Yeah.
there's some like a
Yeah.
bunch of things that are just unexpected. Can you share a couple of those? Because that's what's really
Yeah.
interesting, you know?
Well, I mean, I think unrelated to healthcare, we think healthcare is slow, but publishing they have us beat. I love my publisher. It's an academic publisher, Columbia. And I couldn't have done it without them, but like it will be a year between when I turn to my book and when
Oh,
it's
wow.
finally in the hands of readers. I had to go through peer review in addition to all the usual stuff. So that surprised me the most, was how slow publishing is. But probably what you meant was like any surprises. And personally, I'll say,
Learnings. Yeah.
yeah, I'll say I was surprised by how many people genuinely want to fix healthcare, but are just speaking a different language. And writing this book really helped me see that, innovation often fails not for lack of will, but for like lack of shared understanding of the nuances. And I even see that in my career. I started out as a business school student. So I started out looking at healthcare problems very much from a business lens. And then I went back to school years later after founding Rock Health to get a public health degree because I wanted to ensure that I was also looking at everything through the public health lens. And so I've been able to kind of build those two languages through my work. And oftentimes folks kind of come in and it takes a long time to figure out how to kind of speak the language of healthcare innovation.
I could not agree more. And as a communications person, I mean, words, there's a reason why poetry appeals to, I mean, words are critical, and the words we use, and of course there's not one healthcare system, there's multiple systems. People mean different things when they say different things. And so I think it's so important that you say that, particularly in technology as it relates to healthcare. But and that gets really to my next question when you talk about terms. So massively better healthcare, how do you know what's the definition of
Yeah.
better healthcare? How do we know that we've gotten to something, a tipping point, if you will?
Yeah. It's funny because one of my original titles for the book was 100x Better Healthcare. And my husband pointed out that people like him would expect like a quantitative measurement. And so he's like, people are just going to like push you on that. And so we pivoted and used the word massively better, which is something we always say at Rock Health.
Right.
And it's not necessarily about perfection. It's not about a measurement, but really about alignment. So when incentives, innovation, and impact kind of all finally point in the same direction, I think we'll know we're getting there. Some things that you could measure would be when your zip code no longer predicts your life expectancy, when we start investing in as much in prevention as we do in treatment, when patients stop needing GoFundMe to pay medical bills, when medical bills aren't the number one reason for bankruptcy in this country. And then I think finally, like when clinicians feel proud and supported in their work instead of burned out and just buried in paperwork. I think there are, things that we can point to that, could be more quantitative, but it's really about all aligning in the same direction.
So when somebody finishes reading the book, what will you feel best about? What are they taking away that you're like, wow, I really, this was worth that, all that time and effort that went into this?
Yeah, I mean, I hope they feel permission to stay idealistic. I think we start out in a place in healthcare of very having high hopes, and then it just like gets beaten out of us. And a lot of us become really cynical as we continue on our work. And so I think it takes kind of a new perspective and stories and inspiration to kind of be able to stay idealistic, continue to be willing to learn, and be pragmatic about things. So continuing to be hopeful that change is possible, even when facing, again, these inevitable setbacks that every single founder faces.
And
And
that
then
right
just
there,
knowing.
Hallie, is why we got along from day
Yeah.
one, because you
Yeah.
you absolutely, I know you're a self-described optimist, and the whole point of Health Dame is there's so much shit going on right now. There always has been, there always will be, because
Yeah.
healthcare is difficult. People die no matter how hard you try to make it better. But no matter how difficult it gets, whether it's internally or it's external, it doesn't matter. It's tough. But there are always really good people who, no matter how hard it is, they keep trying, they go in, they do the hard work. They're often not seen, but they do it anyway. They keep trying to push those boundaries. And all I want to do is shine a light on them, get them together, and let them go and do their thing. Because, we
Exactly.
can complain about it all day long, but even if you can move the needle a little bit,
Yeah.
you make a difference. And
Yeah.
if we lose that optimism, if we lose that desire to try things that may very well fail, but that's okay. It would be better if it didn't, but it's okay if it does.
Most
Y-
businesses do fail. And I think we
Right,
have to be okay with that as long as we're failing responsibly and not harming patients.
100%.
Yeah, but I
And
think having, my book is made up of a lot of really great case studies, including Maven. And they're in a
Exactly.
chapter called Work from the Inside Out, Not the Outside In, which is all about not starting with a solution and searching for the problem, but really about becoming an expert in the problem you're trying to solve. I use the word becoming an anthropologist and really
Hmm.
coming and entering healthcare with like a curiosity to fix it and then figuring out how to build something that people love. So would love to also hear from Kate and Neel on this panel
A
because it's
hundred
one of my
percent.
favorite case studies.
Yes, and I'm going to ask Kate next to please tell us a little bit because Maven is one of the case studies in the book. And so tell us a little bit about Maven and what led you to found this company.
Sure. And again, huge congrats to Hallie. Writing a book is really hard. I was a ghostwriter at one point in my past. So I
Oh
know,
my God.
the iterations and
Oh
it's
my
just,
gosh, all the work, but none of the like glory from
of
it.
course, it was okay. But anyways, and this is obviously a very dynamic and complex story to tell. So, congrats. I can't wait to read the full book. But anyways, so Maven, today we describe ourselves, we're the largest virtual clinic in women's and family health. What that means is we cover fertility, through menopause, including pregnancy, including pediatrics, in a virtual care model that gives access to providers, 30 different types of providers across OB, pediatrics, doulas, midwives, mental health providers. So a really, holistic care model. And then we also, one of our mission is about access. Financial access is also really important in our category. We also, provide fertility benefits and reimbursement benefits, and we offer that as part of our platform as well. But back 10 years ago when I founded it, really the impetus, I'm a woman. I now have 3 kids today. My friends started having kids. So it was from a deeply personal place
Sure.
of seeing so many women go through their 20s, and be on equal footing with their male peers, their female peers, to kind of have, so many hopes and dreams in the world in front of them, and then to all of a sudden undertake a family building journey where the disproportionate amount of that is falling on a woman, and to see how unequal that healthcare is for women. And so whether it was my first friend, she had a baby and had really bad postpartum depression. She was the primary breadwinner, had to go back to work. And it was so, so hard. My second friend, this was, 12 years ago. So not as many fertility benefits today, but she worked for a fashion company, no fertility benefits, saved up all of her money. Today has 1 child, probably would have had a lot more if she could have afforded it. And so, there was just story after story after story.
Sure.
And it wasn't just in the US. I was living in London at the time. It was global. I had Israeli friends and Swedish friends and English friends who also just experienced gaps in care in different healthcare models and public healthcare models. And I was an anthropology major.
There
So
you
I
go.
Love
had deep
that.
curiosity in not just my friends' stories and my own story. I started my journey with a miscarriage, but really wanted to understand, like, okay, if this is one of the most transformative moments in a woman's life, and we now cover women and families, and men are an important part of our platform, but back 10 years ago, it really did start with women. And if this is one of the most transformative parts in a woman's life, and her onboarding into the healthcare system, it just has to be so much more supported and better. And so I thought, wow, we could maybe kind of rewrite the care model if we did it virtually with technology, and figured out how to complement the care that they're getting in person and fill in a lot of those gaps. And so, 10 years later, and actually I know some of what Hallie wrote in her book, which I appreciated, is we started with commercial. We also do serve Medicaid. We serve a lot of diverse populations. So particularly even moving to that population, it was like a whole new research project where I met with a lot of
Sure.
Medicaid moms.
Sure.
Their experiences were deeply different than my own. And so really trying to understand that, and continue to anchor our product in supporting all of these diverse experiences. And
How
I'm really
did you
happy.
and Hallie meet?
Well, so in the early Rock Health days, Rock Health was like the thing.
Yes, it was.
I mean,
XX Health,
Hallie
all of
really
it.
pioneered this notion of innovation connecting with the rest of the system. And so really early on, it was clear, like, healthcare is so complex. I've always built Maven from the patient point of view, but really needed to kind of meet more people from the inside of healthcare, from health plans, from employers, from health systems. And so Rock Health was so helpful. And then Hallie, has taught business school classes.
Yeah, you pitched my first. That was the first year
Exactly.
I taught that you
Oh
Long
pitched.
my
time ago, I
God.
pitched
Oh,
a
that's
class,
wonderful. Oh,
which was like
yeah.
honestly probably 7 years ago or something. Like it was a
No,
long time
no,
ago.
it was 2015.
Oh my God, it was
10
2015. Okay,
years.
years ago.
Wow.
Time flies, ladies. Time flies.
Yes, but Hallie has always been a giant in kind of healthcare innovation, and so that was great. And then I'm really excited that Neel's here too, because I think as a founder, particularly one who just uses her own product all the time, really things start to stale when our most important stakeholder, of course, is the provider as well. And so Neel brought that clinical vision, and really kind of has now over the last 5 years helped us continue to transform our care model, to really kind of serve all the diverse populations, but also drive outcomes, because that is to be a healthcare company that's truly moving the needle. You have to drive better outcomes and reduce the cost of care because it's unsustainable where we are today, particularly in maternal health, the outcomes themselves, but also the costs. So,
And we know maternal health care, the numbers, Jane, you've written a ton about this, is just talk about needing massive improvement. So I cut you off. I apologize. Finish your sentence.
no, I mean, I think it's just that our care model now, we're plugged into a lot of different health plans for fully insured populations. We're plugged into employers for commercial. We have a consumer product. We're plugged in on Medicaid and
Amazing. And you're national, right? You're an
global, actually. So about 10%.
global. Okay.
Yeah, we
Very
cover about 23 million lives. We serve about 2,000 clients, and 10% of our members are global. And so to support a care model that's that dynamic and holistic with aligned incentives to the patient, it's fun. And I feel like we're just getting started. We're only 5% of the way into our roadmap, in my opinion.
So how did
And
you
AI
and
is
Neel get together? Tell me about that. How did that happen?
sure.
Who was the
And then
matchmaker?
we can pass it on to Neel. But he was started on our scientific advisory board because Neel has always been we call him the poet in residence as well as our chief medical officer. But
Oh,
I was reading his stuff very early on, and I think we spoke, and maybe you were too busy or something in the very early days, or we met.
Well, you would email me occasionally.
Yeah.
From the beginning, and there were these long stream of consciousness emails. I remember them, but there was always something in it that like was really intriguing to me. And then like Kate asked me to be on the scientific advisory board, and it was such a privilege to do it. It was also during it was the right timing, I think, Kate, because obstetricians are very tactile people. So digital
one
health
would
was
hope.
yeah, right. So digital health, it took me a minute to understand it. Uh, but I think when I joined the advisory board, Kate, it was early COVID, right?
Yeah,
And it
yeah.
Oh, no
And
kidding. Oh,
yeah.
interesting.
yeah, and all of a sudden it was really clear to me that just I'd spent my whole career trying to optimize care within the four walls of the hospital, and the pandemic took every inequity in our society and threw it into a pressure cooker. And it made me look outwards in a different way. And I started to understand the capability that Kate was building differently, as not just Zooming with a doctor, but being able to reach people outside of my hospital. And then being on the scientific advisory board was a privilege. And then Kate was looking for a chief medical officer. This is how I tell it, Kate. And I was like, sure, I'll help you find one. What is a chief medical officer? And then I don't think Kate really knew either. But
No.
we converged on I guess what it is today, and it was too good of a job to pass up. So
And then no, but I remember. And then then I started asking people, what does a good chief medical officer look like? What does a bad chief medical officer look like?
Oh,
How
Lord.
should I approach this hiring process? And so, but Neel, hit all but it was a very nerve-wracking hiring process because I think that doctors
Well,
are
it's a pivotal, critical role, and
totally.
it's very different than what you're doing, but it's complementary. And what's really intriguing and interesting to me, and goes back to your book, Hallie, is the whole notion of what is innovation. Because innovation could be in a payment system structure, in a benefit structure, it could be in how care is delivered, how we measure outcomes, it could be all of these things. And so I think if we're going to get to better healthcare, and words matter, and our ability to be innovative when we realize status quo is no longer adequate. In fact, it's failing too many people. And so, not every physician is willing to come in and be innovative. You're right. Aren't you trained a particular way in school?
Well, I mean, listen,
That's changing too, would you say?
if you're getting care from a doctor, and like the way we measure quality in healthcare is by like adherence to protocol, right? If they're like getting super creative, you should probably slowly back away, you know, in that setting.
Okay.
But my mentor, Atul Gawande, has this way of describing this that I really, really love. And it's part of what brought me to Maven and attracted me to what Kate was trying to build. He says that the biggest cause of suffering today is not lack of knowledge, it's lack of execution on the knowledge we already have. And he distinguishes between breakthrough innovation and what he calls follow-through innovation. Right. And I really felt like, at Maven, the privileges as a technology platform, we can adopt a lot of the extraordinary new capabilities I couldn't even imagine this time last year, from generative AI to as where wearables are going. And also, like, what I really think we're doing is solving the last mile problem in healthcare, which is like how you take all that capability and make sure the people that need it, to Kate's point, can actually access it.
So how does that tie in? You have a new initiative having to do with high risk pregnancies, right? Did I read something about that?
Yeah, I would say
Can
it's
you
new.
talk a little bit about that?
Yeah, so I mean, I think that's the perfect case study in what I just said, which is like we've always taken care of people who had the whole spectrum of needs at Maven, from people who have relatively straightforward pregnancies but still need a lot of support. Right? Like as an obstetrician, one of my favorite things even today is that my friends and family who are pregnant will call me. Like I'm a useful doctor, right? To the people I love and care about. And that's actually what brought me into OB in the first place, is like a male in my mid-20s. It was the last thing I ever thought I was going to do. But I have a lot of cousins. The only person who has more cousins than me is probably Kate Ryder. And
Oh
they
my
were all in
God.
this. Yeah, she's got, I don't even know how many, but
I
there's
have
always a new
one.
cousin.
I have one. It's
Yeah.
so sad.
Betting odds is there's a cousin story that'll come up in the course of.
Whenever I say, "Oh, Neil, my cousin works at Anthem."
Oh,
No, my
there you
cousin
go.
works at this company. All different cousins. My cousin's a pediatrician.
Hilarious.
I've lost track a long time ago, but my cousins were all in this phase of life that were building their families when I started to go into OB. And actually, the way I ended up connecting with Jane, I think even like way back in the day, is I started an organization that was aligned to the Affordable Care Act and was galvanizing clinicians to work in the affordability space. And I noticed that all of the energy was for people over 65, and very little of it was for people who were our age but had the same needs when it came to high risk care management and access and affordability and equity. And anyway, so Maven has always done this, but our recent press announcement was about taking the emerging technology and deploying it to those ends. So it's about, for example, taking in 2024, we were in a world of data scarcity, truly. Like for Maven to know about our members, we had to ask some questions, and we had to wait for insurance claims to get adjudicated or rendered. In 2025, we're living in a world of data abundance, where we have passive data that we're ingesting all the time from our members' wearables, from health information exchanges, from all of these places. And that, combined with the capability to take unstructured data and make sense of it with AI, has changed the game entirely from my perspective.
In a good way.
And so our announcement was like, listen, we're going to lean into that capability. And it's been really, really cool. I actually just got done interviewing a neonatologist, and we now in 2025 have the ability to know the exact second when a baby's been admitted to the NICU. And that's a moment where parents are so overwhelmed, but we can proactively now, in a really timely way, come in and support them and, make sure they get the care that they need.
Oh, wow. That's absolutely incredible. And Jane, your name was taken, so and this is the perfect time for me to ask you. You've done a lot of work on studying innovation, the different dimensions and measurement. And so when you, from a big picture, look at improvements and improve, how to measure, what are some of the things that you've looked at over time, some of the trends that you're studying? Because
Um,
I bet they're in Hallie's book in some
yeah.
fashion or form.
Well, I mean, the time for Tally's book is so perfect right now
Yeah.
because as I think about the origins of Maven and then with Kate and Neil coming in, the need of the patient, the person, the caregiver, the mates in the transaction. I mean, it's all about this noun, which is the patient who's been overlooked for a long, long time. And so for me, in the work that I'm doing right now, which is heavy on the self-care retail, like people are on their own, what can we do? The fact that Maven treats across socioeconomic strata
Hmm.
and globally increasingly delights me to no end because the need is there. And when, as an economist, when we talk about need, there's abundant need, but it's demand, which translates need and ability to pay, is the demand side. So the fact that Maven, as an example, is working across different health plans, commercial, public, self-pay, consumer, omni patient, omni channel, omni
Sure.
pay. This is all good. But I'm coming back to that consumer now because this is the pivot point right now where we're in this age of grievance for both consumers, patients, caregivers, and clinicians.
What do you mean when you say grievance?
And that's what I want to get to because when I study and I've collaborated with Edelman for many years on the trust barometer,
Right.
this year's trust barometer was subtitled The Age of Grievance. And this is
Oh,
across all industries, all verticals. No one trusts no one globally. This is a global study over 20 countries as of January in Davos when they announced it, but it's still true. We have a new study just out a week ago on AI and trust. Um, no one trusts government anymore. I mean, no one, meaning the plethora of people. NGOs aren't trusted generally. And so who's trusted is my employer, which is why the Maven model of working through employers is can be so powerful.
oh,
Uh,
that's interesting.
in COVID, we learned that messages coming out of employers, HR departments on where's a vaccine, where to get a vaccine, should I get a vaccine? It was the employer, if you were lucky enough to be employed during the pandemic era. That's where trust was, and it still is today. Um, Grievance comes from the fact that globally, people don't think government's responding. Media is distrusted,
Yeah.
whether you're on the right or the left or the middle. So we're at this perilous time where there's grievance, people saying, I don't trust anybody but my family and friends and my employer. So trust goes local now, as Edelman talks about his recommendations, their recommendations. How do you rebuild trust? So now we put this lens on healthcare, grievance in healthcare. And I mean, every week now I'm noting and weaving the trends on where is grievance in healthcare. It's everywhere. So we think about this issue of affordability, which is real. It's not a con from any quarter. People can't afford daily living stuff. So this week, Dollar General came out and said the fastest growing market we have at Dollar General is affluent people making $90,000 a year or more at a dollar store. So this is the growth area, people seeking value wherever they go. And grievance in the form, the ultimate grievance, if you will, which I've written about, taken some heat on with Luigi Mangione's trial in New York going on right now.
Yeah,
That's the
yeah.
ultimate grievance. You go and kill an executive from a health plan. I mean, we think that's where that came from, from clues. And in any case, so we have that's the ultimate expression,
Yeah,
right?
for
Go
sure.
postal, go whatever. And then you have this affordability crisis. And in the middle of all that, If you are wonky like me, you talk about the K recovery in the economy in the US and around the world. If you have money vested in a 401k or in the market, you're doing better. If you're not in the market, you're doing worse. That's the K. And that's a problem when you're, a mainstream person looking to buy groceries, pay your bills, whatever. So in this age of grievance in healthcare now, patients are saying, I feel like I'm on my own, particularly now if you're hanging on the legislative thread of whether I'm going to have my ACA plan subsidized or not. And new data again this week from Kaiser Family Foundation shows, regardless of party, I can't afford to buy at the retail sticker
People
level
still
my
trust,
health insurance.
do they still trust their health provider, their doctor, their nurses, their whomever?
So we know, thank the Lord, the most valuable, respected, trust and honest human capital form in the United States in the Gallup poll, year after year after year, is nurses, doctors, and pharmacists. Sometimes doctors and pharmacists fall third and fourth, but generally nurses way beyond everybody. And at the bottom is people in Congress, people who sell cars, and people in the ad industry. The last 5-6 years is the
Right,
bottom. So, I
right.
mean, we have the human capital, and that gets to the clinicians now, thinking about grievance among doctors, nurses, pharmacists, frontline workers who feel terribly abused, unfairly treated, with growing consolidation, which I'm sure Hallie's talking about in the book, the threat of consolidation and privacy. So this week we saw the formation of a physician group called, is it IndyMed? Independent doctors, 70,000 of them coming together to form a new association on Wednesday. This was announced, Wednesday, December 3rd, for people listening in the future. Independent doctors wanting to stay independent, surprise billing issues, all of that. So we can bring clinicians and patients together now in this age of grievance because we've got shared mind share that we have to do better. And with more patients taking on more knowledge for self-care, for empowerment, for engagement through things like AI, wearables, peer-to-peer healthcare, which our friend Susanna writes about. It's an exciting time to see things I believe, will pivot in the coming year or two because of this.
So, Hallie, when you were putting the book together as a roadmap for people, is there something in the book about um, people, patients, and the healthcare system,
Yes.
people who are providing care, paying for care, whatever with care, but the patients have a role and a responsibility and caregivers. So,
Yes.
can you talk a little bit about that?
Yeah, I actually have the longest chapter is the chapter on stakeholders, and it covers the non-consumer stakeholders, and then consumers. We get an entire chapter. I felt like having it be part of the broader stakeholders almost buried the importance of it. And so I have a whole chapter about what I call the consumer uprising, which is so
Yeah.
very obvious. And Jane spoke to this and culminating in the shooting which happened as I was finishing up the book, and I did include that as symbolic
Yep.
of
Yep.
where patients are today in their frustrations with the healthcare system. There are some other examples that I shared, including people now suing their employers for their lack of fiduciary duty to use their healthcare dollars wisely. And we're seeing more and more of these folks holding their employers accountable. And I'm on the board of Collective Health, and we work with employers as a modern TPA. And we're hearing that from employers as well, of like, finally, it's not just containing costs because they're out of control, but containing healthcare costs because our employees are demanding that. And as we all know, as healthcare costs go up for employers, and employers are the number one way people in the US get coverage, that wages go down. So it's really coming out of the pocket of employees. And in so many ways, we are at a tipping point. And that is an opportunity for us to completely rebuild this. We have collectively, as patients, as healthcare consumers, we have power when we come together and voice our concerns. And never have we heard so many voiced concerns as we have this year in 2025.
It's really interesting to see, and I think as the wearables and people's comfort level with technology, because they're using it in all aspects of their life. So younger people, of course, they're digital natives. It's much more comfortable, but people my age, it wasn't as comfortable. I mean, some for sure were. For me, not so much, but I'm getting there, and it's unavoidable. And the more you get comfortable with it, the more you feel like you can push back a little because you have a little bit more to work with because data matters. And
You feel empowered.
you do. You
Yeah.
do. And luckily, I'm from Brooklyn, so I felt really empowered and not afraid to use my voice even before I had any data to back it up. But it's a very good combination now that I actually have facts to go with my yeah. When you're advocating for someone, you're going to go all out for them. They're sick, they're dying. You need to, you're not going to take no for an answer. But so let me ask you one more question before we start wrapping up. I know we're getting close to time here. If have you seen a change since you started writing the book? Like if you were going to add one new chapter based on like some of the students you see coming
Yeah.
in, is there something that if you were writing it today, you might have added to the book?
Well, if publishing timelines weren't as slow as they are, I would have gone into more detail about AI. But I knew that if
Uh-huh.
I were to say anything about it, it would be outdated as soon as
Right.
the book is out. So I talk more broadly about the opportunities for technology and really leave it up to the reader and the innovator to do that work. And I'm just kind of supporting them on
Well,
staying
yeah.
on the business model, on kind of staying on the right path. So that's what I would say. I would speak more about AI. And one thing that is a big takeaway for me this year when COVID happened and we saw rapid adoption of technology, specifically virtual care from providers, we all were so excited and we said, what the adoption that we have seen is what you would expect over years, not months. And we were all so impressed at how quickly providers were able to adapt to the new world. But we all thought that that was a blip. We all thought that we would just kind of go back to
How it
very
was.
long adoption cycles. But what we've seen this year specifically is that instead, what happened was that providers built capabilities for technology adoption. They've hired people and teams and built processes for evaluating new technology. So this actually hasn't gone back to pre-COVID. We have now seen adoption in healthcare of AI tools that's faster than other industries. We are now so excitingly leading the way in use of AI within the provider world versus being like a lagging industry. And that is so exciting. I don't touch upon that in my book. It's not really related to my book, but it's something that I'm really excited to see because healthcare, if anything, we deserve the best state of the art technology, especially when it has proven ROI and can help us rip out some of the wasted administration costs, help deliver care faster, better, cheaper.
And more conveniently for patients. When NCQA measures quality would do surveys of patients, often convenience was measured from a patient standpoint as a quality indicator. It didn't mean they had a better outcome. It meant they had a shorter stay in the waiting room and all of that, which does matter to people for all the reasons we know. But I always close with my question about music. So I hope you came prepared with your favorite song because for those who are listening for the first time, I'm curating a Health Dame Spotify playlist of songs that speak to each of the panelists because music and the brain is so important, I think, in everyone should be listening to music, Patti Smith and others. So Halle, what's your song for the playlist?
Yes. Okay. I'm going to choose my absolute favorite karaoke song. So if any of us ever do karaoke together, we can sing it together because it's so
Okay.
much fun to sing. And that is The Dog Days Are Over by Florence and the Machine.
Oh,
Um, it is
fabulous.
it's such a hopeful song. It's energetic. It's a little chaotic, which just feels like the right soundtrack for trying to fix healthcare in
There
the
you
US.
go. Voila. Okay, very good. Kate, you're up.
Well, one of my absolute favorite artists is Nina Simone, so I'm gonna have to go.
Oh my God, me too. Okay. So which one? That's it's hard to pick one.
Yes, well, if you're asking my absolute favorite, it would be Feeling Good.
Yeah. Okay, that's
Oh.
perfect. Great choice. All right, Neel.
I don't know where this fits on the playlist, given the vibes of Nina Simone and
You'd be
Florence and the
surprised
Machine.
who I've gotten on this list. So everything is it works.
Well, I feel like going with The Reckoner by Radiohead because
Awesome.
the title, obviously, but I also think Massively Better Healthcare is like a moral obligation. And I actually have no idea what the song's actually about. Like, who knows what's in Tom York's head? But I feel like it's a song with like moral weight. And I feel like it's about like leaving things behind towards something better.
Oh, I love that. That's great. Jane, take us home.
I will. So I'm a girl from Detroit. And I didn't pick Motown though. I picked the Staple Singers
Good.
1973 classic Come Go With Me, ending on an optimistic note, which came out of the civil rights movement. And one of the best lines pertinent here is love is the only transportation to where there's total communication. And that's our book, Massively Improved Healthcare.
Oh my
So
God, how
gotta-
fab. What a great note to end on. So
Come
we'll
go with
with
me.
that. Thank you guys so much. We will have this up next week. We'll have a transcript. We'll have links to all of your sites. Maven, I love the work you guys are doing there. Jane, keep up the big trend setting. Halle, I can't wait to read the book, Massively Better Healthcare by Halle Tecco. Congratulations. And I do want to wish everyone a very happy, healthy holiday season as we get into our wrapping mode and presents and all of the above. So thanks so much for taking the time today, guys, and I'll circle back with you all soon. Thanks again.
Thank you.
Thank you.
Hey, Neel,